Let's talk about birth partners. Birth partners can be your life partner, can be your best friend, can be your sister, your mom, an experienced doula, someone that you really trust to be with you by your side, someone that you feel supported by, someone that you feel can add value to helping you to relax in your labor. Never accept a birth doula that gives you stress, that makes you have an uh-oh feeling, or that you feel like you have to invite to your labor. That is not, this is not the time for that. So a birth doula is a wonderful addition to a birth because they can be there in addition to your life partner or your mom or your sister. A birth doula is someone who has been at other births. I encourage you to hire an experienced birth doula. That there are a lot of people who do a few births and call themselves a doula, and having an experienced doula who's been at dozens and dozens, if not hundreds or thousands of births, they are just going to know birth inside and out. They're going to look at you and know what's happening. It's an amazing gift to have someone who really understands childbirth and can step in. And the way that they step in the course of labor is not just that they get between you and whoever is there to support you. A birth doula sometimes whispers in the ear of the life partner and says, like, how about you do this? Or how about you do that? And is off talking to the nurses, making sure that things are going smoothly, like will be the interface, already has a relationship with the nurses because they've attended so many births at the hospital that you're at, or has a relationship with the midwife that you've hired to be at home. Sometimes if you hire one midwife, I know I had two that came to my birth, my 3 births, but if I had only had one, I would have also wanted a doula, someone else who's just dedicated to being right there, who's not focused on the medical side. A doula is not a doctor, and a doula is not a nurse. Your nurses are wonderful at the hospital. They are beautiful, dedicated beings, and they're busy. They have other patients that they're also taking care of. They're required to chart every single thing that they do. They spend a lot of time in front of their computer. So that isn't someone who's going to be sitting there holding your hand for, the time that you may need it. So a doula is wonderful. Natasha Joyer is my favorite doula on the planet, and she is working on putting a ton of information out on the internet. I will link to it in the description, so please look for her if that is going to be helpful to you. And I know many, many mamas who've given birth with her, with other doulas by their side, who have never regretted it. And there's a National Association of Doulas that has put out some statistics, and I'm going to read these statistics because they're pretty awesome. So having a doula-assisted birth, you are 50% less likely to have a cesarean, 60% less likely to request an epidural, 30% less likely to have any kind of pain medication, 25% shorter birth experience. That's amazing. 40% reduction in Pitocin use, 40% reduction in forceps use. So, that's all the reason. Let that speak for itself. Never mind, when you interview experienced doulas, you will find who fits for you. So they add education during the course of your pregnancy. They add support during your labor. It's just, they give a really beautiful service if you're able to hire one. And if you're not, other birth partners that are not professionals, I've been talking to you through this entire series. I hope you've been watching and listening and taking notes. And this is just the summary of what I want to express to you, which is you are here to help mom stay way as far down possible on the scale of discomfort as possible. We've talked about the scale of 1 to 10, 1 being mom is so relaxed, she's practically asleep. 10 is I can't handle this anymore. And your job is to help her through techniques of touch when wanted, through techniques of visualization and hypnosis, which you need to practice while she's pregnant so that it doesn't feel awkward and new when she's in labor, reminding her about breath and position, and offering anything you can offer, being the interface for the caregivers so that she's not being asked questions, being the keeper of time if time needs to be paid attention to so that mom never sees a clock, never knows how long a contraction is, all those things. Her logical mind needs to tune off. Her animal brain of just presence and relaxation is really all we want to have available to her. So we are working hard as birth partners to allow mom to focus on childbirth, because that's all, right? She needs to focus on relaxing her body and working with her baby. And that is a full-time job. So please do your homework between now and the birth of the baby that you are in support of, and listen to all of the recordings, do the practice exercises with your pregnant mama that you love, and you will be an integral support and be right there to welcome this baby into the world. So what a blessing. Thank you for your support. Thank you for being willing really to do the work of supporting a mama in labor. It's such a gift.